At this time, I would like to introduce Dr. Charles Dolph.
Okay, hello, welcome. I'm glad that you came today. I'm thankful for the opportunity to get to talk to you. Let me tell you that I'm a psychologist, and for about 30-some years, I have worked with Alzheimer's patients, but in that time, I've probably worked more with caregivers than I actually have with the patients. We know that the patients suffer from Alzheimer's, but it's important to note that the caregivers of Alzheimer's patients suffer too. They bear along with hardship and pain. Well, we are human beings. We are finite, we are limited, we are biologically based, and because of that, suffering is inevitable. I doubt that you will escape this life without suffering. Suffering is just a fact of life. It will happen. If you haven't suffered to this point, you're extraordinary. I'd like to interview you afterwards. But while suffering is inevitable, misery is optional. Just because a person suffers doesn't mean that they have to be miserable. And we need to remember that when we deal with people. As a psychologist, I have to remember that all the time, because people do come in with terrible, terrible situations that I pray that I'll never be in. But I might be, and whether I am or not, they're in that situation now. How can they make the most of that situation? How can they suffer well without lapsing into misery and hopelessness and meaninglessness? That's the challenge. And let me assure you that there's always something we can do. No matter how bad you're suffering, there is something that we can do for you. There is some way that you can find help so that you need not be miserable in your suffering. In fact, if you think about it, some of your greatest inspirations, you think of the people that you know and respect the most, and many times those are persons who bear with great suffering. Like right now, I'm thinking of a person who has bone cancer, advanced bone cancer, and has very severe and deep pain. And yet that person has an indomitable attitude. And it's a reminder to me that even though you may be in severe and continuing pain, that doesn't mean that you have to collapse into despair. And that's my role as a psychologist, but actually that's all of our role as community members, to help and encourage one another. And I want to today focus especially on how we can help caregivers deal with their stressors and their suffering so that they can be healthy and resilient even though they are struggling with some severe situations and difficulties. In fact, today in this talk, I will focus primarily on psychosocial problems, and at the end we'll talk a little bit about spiritual existential forms of suffering and the solutions to that. How caregivers deal with their feelings is a very good predictor of how they will cope with caregiving. When you first get the diagnosis, or when you first realize that your loved one has Alzheimer's or some other dementia, and you begin getting an idea of what that means and what's likely to be in store for that person and for you, it's easy to be overwhelmed. Some people just deny it. Oh, it's no big problem, we'll deal with it. And other people, it just blows them back. And I think that we can, to some degree, predict how well that caregiver will do, whether it will make them or break them, by how well they deal with their emotions. I think Chuck Swindoll said a long time ago, life is 10% what happens to you, it's 90% what you do with it. Attitude really and truly is important. Good attitudes help, bad attitudes don't help at all. So I hope that as a result of our talk today, you will be more, if you're a caregiver, or if you take care of caregivers, you'll be more aware of caregivers' feelings. Now, all the feelings that I'm going to talk about are normal, predictable feelings. There's nothing abnormal about the feelings that I'll be presenting. If you're a caregiver, you will have these feelings. But what's absolutely crucial is what you think about those feelings and how you deal with those feelings. Deal with them well, you'll minimize your stress. Deal with them badly, and your stress will compound. Fatigue. Fatigue. I mean, the universal response to caregiving is exhaustion. First and foremost, it exhausts you. It exhausts you because it's hard work. And it's hard work because not only is there actual physical work in it, but the thing that really pulls people down is the constant vigilance. Constant vigilance. The other thing is that when we're tired, when we're exhausted, we're vulnerable. People are much more likely to get angry, to blow up, to say something they wish they hadn't said, to be snippy or snarky, or to just act out. Exhaustion makes people vulnerable to saying and doing things that they wouldn't normally do, and then that, of course, makes them feel even worse. It makes them feel bad, it makes them feel guilty. So, caregiving is exhausting, and for all those reasons, what can you do about it? The thing I have to constantly remind caregivers of is that caregiving is a marathon. It's not a sprint. It's not a 100-yard dash. It's more like a 26-mile run. And you've got to pace yourself. You can't give everything up front. And we want you as a caregiver to live through this. We want you to be there in the end. There is life after caregiving if you don't get exhausted and burn out along the way. Now, how do you keep from just fatiguing out? The answer is you've got to keep a regular schedule. Now, it may be a scaled down schedule. It may not be the schedule that you used to keep. But people thrive on routine and regularity. Patients, Alzheimer's patients thrive on routine and regularity, but caregivers do too. Because when you have a routine schedule, it helps your life to seem more predictable and more under control. And what really totally stresses people out and makes them sick is the lack of predictability and the lack of routine. We like it. We thrive when life is predictable because it feels like we are in control. But when life gets unpredictable and out of control, people get sick, either physically or emotionally. And one of the ways that you keep that predictability and control in your life is to make a schedule and stick to it. You're your loved one's greatest asset. If you go down, everyone suffers. If you go down, not only does your loved one suffer, but your spouse suffers, or your kids suffer, your neighbors, the people that love you and depend on you, they all suffer. You have to stay strong for your caregiver, and you'll only be there in the end if you make a schedule and stick to it. Okay, the second set of feelings that are totally normal and totally predictable are these. You're going to feel sad. You're going to feel confused because this is new to you and you don't know what's in store. You're looking at an uncertain future that you don't know a lot about, and so that's going to be confusing and somewhat disorienting to you. And very likely, somewhere along the way, you're going to experience some depression. Maybe just mild, maybe more severe. But caregiving comes with a certain amount of depression. Now, hopefully that's transient and it passes. For most people it does. But for some persons, the depression takes hold, or it gets a root. And so then they have additional challenges. Now, the reason for these feelings is clear. There's loss. There is a continuing loss. The loss gets more severe as time goes on. So it's not like a one-shot loss. It's a loss over weeks and months and sometimes years. And each loss hurts, especially when you're feeling down. You say, I just can't take anymore, and then there's another loss. And it's like, the uncertainty of what tomorrow will hold. You ask someone to do something, like maybe if you're a caregiver, someone's asked you to go somewhere in a month, or to go to an event or an activity. And I hope you said, yes, I'll put it on my schedule, and I've got a month to arrange respite care. That would be a great, healthy response. But do you know what the usual response is? Oh, I don't know where we'll be in a month. I don't know what'll be happening. I don't know how bad he'll be. I don't know if I'll have anyone to help me. I haven't been feeling too good. I don't know if I'll have enough energy to go. Oh, I don't know. I better not. I don't want to commit something and not be able to do it. Oh. And do you see how life then just sinks down into this uncertain morass of, I can't plan anything, I can't count on anything, I can't look forward to anything because I don't know, I'm uncertain. That's not what I want to see. That's why I say scheduling and making some commitments is really, really important. It's also depressing because we have to change long-standing habits. I think the hardest thing is changing roles. When you have to become a parent to your parent, or when you have to become a parent to your spouse, you are learning a whole new job, a whole new role. It might be taking over the finances, it might be taking over the cooking, it might be handling the yard work, it might be handling the housework. But we go through our lives for 40 or 50 years getting our role down so that we're good and efficient at it, and then suddenly, not only do we have to do our role, we have to do someone else's. And that's doubly hard because we've got to learn a new role, and we have to give up parts of our role because we can't do both roles completely. And so there's a double change there, and there's grief and change and stress that comes with that. We sometimes define stress as a Hans Selye defines stress as the non-specific response of the body to any demand placed upon it. Anything that requires you to change is stressful, even a good thing. Grieve. It is okay to grieve. Grieving during the process of loss is good. That's not a bad thing. Sometimes we feel guilty about grieving, but it is grief as you lose your loved one, as you lose your role, as you lose the lifestyle that you've had for a number of years. Grieving is a normal, natural part of dealing with an illness like Alzheimer's. Don't try to save your grieving till afterwards, because if you do, you will be so messed up that it will be very difficult for you. Focus on what you can do, not on what you cannot do. Oh yeah, that's kind of like housework. Have you ever spent all morning or all day doing housework, and you look around and it's like, I've done nothing. I've wasted today. Well, That's easy with housework. That's easy with paperwork. But that's true in life, too. When you're caregiving, no matter how much energy and effort you lay out there, there's more that could be done. And if that's what you stay focused on, you will get very discouraged, and you'll feel very beat down, and you'll feel very inadequate, and you'll feel like a failure. It's important that you do not catastrophize. Some catastrophic statements that I hear all the time. We say things like this, I'm losing my mind. I'm getting Alzheimer's. He's better off without me. She doesn't love me. My life is ruined. I'll never be happy again. I'll never get through this. I'll always be depressed. I'm trapped. I got no choice. Those are things that we say in frustration and despair. They're not true sayings, but that's the way we feel at the time. And it's important that you recognize that's an expression of feeling, but that is not a fact. And so it's a fact that you're feeling something, but the feeling that you have may not be factually true. And you've got to separate your feelings from the facts of the situation. Faith, you've got to believe. You've got to believe that God will help you. You've got to believe that you can come through this. You've got to believe that this is not some situation that you can't get through. You'll feel like that, but that doesn't mean that it's fact. Optimism is always better than pessimism. Always. You look at the psychological literature. Optimists survive. Pessimists don't always survive. You've got to believe and be positive that you can come through this and that you're not a total failure and you're not totally inadequate. All of life is learning to live with limits. We only have so much time, we only have so much energy, we only have so much money, we only have so much intelligence. And we get to thinking, if I just had a better house, if I just had a walk-in shower, if I just had the money to provide more care, if we could just move to a better place, if I could just find a better facility, if. And what if thinking doesn't get you anywhere usually except more depressed? Schedule daily activities and stick to that schedule, even if you don't feel like it. Don't decide what you're going to do in a day based on your feelings that morning. Oh, I know I wanted to go out and take a walk today, but I don't feel good. I'll just stay in. Stick to your schedule. Make sure your schedule includes rest and recreation. Tell yourself the truth. Okay, now, a third expectable feeling is this. You are going to be angry. You are going to get angry probably a lot. Be prepared, or if you're already there, your anger is not unusual. It is incredibly frustrating to deal with people who have Alzheimer's. Of course, the patient doesn't learn by experience. And how many times do you say, "Why did you do that? You know better than that. I can't believe that you did that. Didn't I just tell you?" Yeah. But once those neural networks break down, stuff doesn't stick. And people do the same old things over and over. And to those of us whose neural networks are still somewhat intact, it just gets us. So what do? Lower your expectations. Lower your expectations. I'm going to expect less from my loved one. My anger is not this person's behavior so much as it is my expectation of what their behavior should be. When you've lived with someone for a long time, you just expect them to do what they've always done. And when they stop doing that, it's frustrating and disruptive, and it pushes you into new territory, and it's time-consuming, and it's disorienting, and it makes you mad. Set realistic goals. The best goals for dealing with Alzheimer's is giving. This is really a hard and subtle thing. We've got to get ourselves turned around so we're not expecting things from our Alzheimer's patient. We're more focused on giving things to them. When you expect a response, something as simple as just cooperate with getting your clothes on, or stop doing that. Stop dragging those clothes out of the drawer, or stop hiding the silverware. You find silverware all over the place. It's like, stop that. It gets you upset because you expect the person not to do that. But rather, focus on what you have to give. You don't have much control over your loved one's behavior, but you do have control over your own behavior. And the one thing you can do is you can give. You may not get, but you can give. And if you keep that focus on giving, today it's my goal to give my partner, my spouse, my parent, whoever it is, my goal is to give that person love. I'm going to give that person safety, companionship, stimulation, encouragement, respect. You see, you can do everything on that list: safety, companionship, stimulation, encouragement, and respect. And those pretty much don't depend on the individual's response to you. The person might be totally disrespectful back to you, might be totally uncooperative. But you can still show respect, you can still show encouragement. It's hard, but you can do it. And then you go to bed feeling like, I gave something worthwhile today. He was terrible, but I delivered. And have to be satisfied with that. This is one of those things that you know, but you still do. Don't argue with someone who has Alzheimer's. You don't win. You get madder, and it doesn't end well. Do not argue. Walk away from arguments. Remember, this person doesn't use logic. Never argue with a person who doesn't use logic. That's basically Alzheimer's patients and kids. Avoid arguing with either one. To deal with anger, learn to communicate Alzheimer's style. Keep your life balanced. And here's the key. Especially when it comes to anger, ventilate. You need other persons that you can talk to. You need someone that you can go to and say, I got so angry today. Or I saw myself in a mirror and I can't believe how red I was. Or my neighbors were walking by and they looked at me kind of strange. I was really angry. You've got to be able to say that. Keeping anger inside does not work. It makes you more vulnerable to doing something that you don't want to do. Anger needs to be discussed. Now, I'm not saying you got to go pound on stuff or scream or do things like that, but I'm saying you've got to talk to someone about it. Journal it. Facebook it. Email it. Talk to a friend. Talk to someone in your support network. But talk about your anger. People get embarrassed and ashamed about their anger. Keep it in, and then it grows. People feel weirder and weirder, and eventually they lose perspective. The next expectable, predictable feeling is guilt. Caregivers feel guilt. Why do they feel guilt? They feel guilt because they're human. So one of the ways to feel better about your guilt is to remember that the people who really love you and the people who really care about you do forgive. They really do. We feel guilty because we're human, because we make mistakes, and also because we get angry. We have to be very careful that we don't fall into the anger. No, I'm going to take that back. When you fall into the anger guilt cycle, You need to be very careful to recognize it and pull yourself out of it. I changed that because this will happen. What happens when you get really disproportionately angry towards the person you're caring for? You feel really bad after that. You say, how could I do that? How could I say that? How could I be that? How could I be that mean? I am so sorry for that. And then what do? You spoil the person. You try to make up for it. You're especially nice. Maybe you relax your boundaries. Maybe you let that person do something that you normally don't let them do. And then what happens when you relax and overdo it and indulge a person? They start taking advantage of that. You just violated your boundaries. You're doing something outside your boundaries. The person, of course, likes that and enjoys it and wants more of it. And then what do? You have to say no. And it's like, you've been doing this, or you let me do this yesterday, and then you've got to say no, and then they get mad, and then you get mad, and then you feel guilty for getting mad. So anger and guilt cycle around. And the way out of that, I'll tell you in a minute. No, I'll tell you now, is to set boundaries and don't violate your boundaries. No matter whether you get angry or not, live within your boundaries. Live within your boundaries. People who get outside their boundaries, people who do things that they know they shouldn't do or aren't particularly good for a person, but people beg and plead and cajole them to do it. When you get outside your boundaries, you will get burned. Don't go outside your boundaries. So what do? Keep perspective. Probably the most important thing I can say on this topic is faithfulness, not perfection, is what counts. That's why you hear me emphasize schedule. Take care of yourself. I want you to be there at the 100-mile marker. Because we're not perfect, and caregiving is arduous. It's hard. It's difficult. And you're going to make lots of mistakes. You're going to feel exhausted. You're going to feel depressed. You're going to feel angry. You're going to feel guilty. That's just a part of it. But good caregiving is not feeling those things, and good caregiving is not making mistakes. Good caregiving is being faithful and persistent day after day after day after day. And you have good days and bad days in that. You have good weeks and bad weeks in that. But persisting, enduring, staying committed to the person, that is what matters. It's very important that you be more committed to a person's good than what a person wants. What we want and what's best for us is often two different things. I think the best definition of love is acting in a person's best interest. I like that definition. If you really love someone, you consistently act in their best interest. So, the way that you get out of guilt is say, I did what's best for him. Have you been through the taking away the keys thing? Taking away a person's driving privileges is not a happy time. And that's one of the big turning points with people, is when they lose their ability to drive. And especially if you have to take those keys away, it makes people furious, and they get angry, or they get pleading, or they get pathetic. And you think, well, just to the store, or it's only 2 blocks away, or you want so much to calm them down or show that you like them or something, but you can't afford to do that. Act in their best interest even though it doesn't make them happy. And don't feel guilty. Tell yourself, I love this person. I acted in his best interest even though I didn't do what he wanted. Don't go beyond your limits. The whole world divides up into 2 categories. There's one really big giant category And that category is what you cannot control. And what's the other category? Real tiny little category. That's what you can control. What should you do about the part you can't control? Let it go. Please, let it go. What should you focus on? That little part, which is largely within your skin, and even not all that is controllable. But what you don't want to do is try to control what you can't control and let go what you can. We've talked about several difficult or negative feelings that you're bound to have and what you can do to minimize them. I want to talk about a couple good feelings. If you hang in there, if you're able to more or less roughly follow some of these guidelines, there's a good chance that you'll feel satisfaction. You'll be able to say, I demonstrated my love. In other words, I looked out for that other person's best interest by making a commitment to that person, to being committed to their good and sticking to it. I hung in there on one of the most difficult challenges of my life. That's a really good feeling. I mean, those of you who volunteer with the Alzheimer's Association, many of you are in that category. I got through it, and I learned something from it, and I want to help others with that now. It's satisfaction. I made it. I really made it, and you can make it too. I love our volunteers, because our volunteers are people that exemplify this in their lives and in their willingness to help others. So here are the guidelines for survival. Here's kind of a summary. Pace yourself for the long run. It's not a sprint. You're your loved one's greatest asset. If you collapse, everyone loses. Schedule, schedule, schedule. Your schedule may be abbreviated. It may be kind of spare, but make a schedule that involves respite, recreation, and worship. Routines carry us through hard times. When we go through terrible times, whatever it is, it's our routine that gets us through. When we're just walking in a fog, barely putting one foot ahead of the other, it's the routine tells us what to do, and it gets us through the hard times. Lower your expectations for yourself and for your loved one. Set realistic goals. Remember that caring for a person with Alzheimer's is more than a full-time job, mentally and emotionally. Focus on what you can do, not on what you can't. Expect to feel fatigue, frustration, anger, and guilt. Schedule regular medical checks for you. How many people get good care for their loved one and neglect themselves? Once again, neglecting what you could control. Expect to grieve. Ventilate your feelings to your supporters. Network. You need to be talking to people. You need to be talking about feelings. You need to be talking about your thoughts. You need to be talking about the crazy things that go through your mind. Get them out, they'll go away. Keep them in, they'll get bigger and stronger. Don't take responsibility for another person's feelings or happiness. Act in their best interests. Set limits for yourself. Don't violate your limits. And rejoice that you could make such a sacrifice for someone that you love. Caregiving may be the hardest challenge of your life, but it's also an opportunity. It's an opportunity to prove that we love unconditionally. It's an opportunity to demonstrate faithfulness to a spouse or a parent. It's an opportunity to give without expectation or reward. We tend to live in a materialistic culture, and we joke about what's in it for me. Caregiving is an excellent opportunity. It's often one that's thrust upon us, but it's an opportunity to define who and what we are. We find meaning and purpose in achieving goals like this. This makes you who you are. Or maybe who you are allows you to be able to do this. Caring for someone is an opportunity to learn that material things are not the most important things. As people move into Alzheimer's, stuff means nothing to them. And that's a powerful lesson of Alzheimer's. Characters formed in the fire of trial. Trials determine whether we become mean, bitter persons or gracious, hopeful persons. Caregiving is a trial. It really is. Handle your emotions well, and you will come through it healthy and resilient. Let your emotions get out of hand, and you will struggle big time with those emotions that we discussed. Persist. Don't give up. This is all normal stuff. I can talk to you about it because I've seen dozens and hundreds of people go through this. If you're going through it, just consider yourself normal. The key thing is, do something about it. Thank you. Thank you very much.